Hi, everyone. Thank you so much for joining us for our second Georgia Bio Patient Advocacy Roundtable of the year. We are very excited to have a pre-recorded Jack Ganter from Congressman Buddy Carter's office, as well as our illustrious Georgia Bio Patient Advocacy Alliance Chair, Dorothy Leone Glaser, and patient Thomas Walters from the Lupus Foundation, who we will be featuring later in the program. As we are getting started, we're going to continue to let some people into the room. We know we are having some technology issues today, but we are going to get started with a conversation with Jack Ganter in Congressman Buddy Carter's office about effective legislative advocacy. So if you will bear with me one moment, I will get that loaded and ready to go. Can everyone see that?
Yes.
Jack, thank you so much for joining us today. Everyone, this is Jack Ganter.
Ashley, you'll need to unmute yourself.
Absolutely. Well, we'll start with a softball question. Can you give us a little bit of background on what you do for Congressman Carter's office?
Sure. So as you mentioned, I cover the Congressman's health portfolio. So Congressman Carter's on Energy and Commerce, is on the Health Subcommittee. So any and all health-related work that the Congressman has going on legislatively falls under my portfolio. And I've been with Congressman for almost 3 years now.
Excellent. And how often does your office or you specifically work with coalition or advocacy groups?
Every single day.
Well,
Click it. Network error.
I tell you what, Dorothy, do you want to go ahead and do the patient spotlight with Thomas? And I'm going to try to figure out what's going on here.
Absolutely.
I'm so sorry for the
That's okay. It
happens.
happens. That's what I said. It doesn't matter how long we're doing this. We must always be prepared for a snag. And today seems to be full of them. By the way, Jack Ganter is a great legislative health advisor for Buddy Carter. We do work with him a lot. And in fact, I recently sent him something and he said he'd make sure that it was shown. So I'm going to take this moment now to introduce our guest, Mr. Thomas D. Walters from the Lupus Foundation. And Thomas is a support group leader. And he's very unique, even as a lupus advocate. He has had systemic lupus for 16 years, including difficulties with platelets, anemia, and of course, what many of us suffer from is lupus nephritis. He's been working with the Lupus Foundation, and I love talking to Thomas. One of the unique things that Thomas does, something that I did many years ago, is that he has a men's group, a men's lupus support group. And Thomas, tell us a little bit about your support group. It's wonderful that men's voices are being heard. Most people don't even realize how men have systemic lupus.
Okay, good afternoon, everyone. First of all, I'd like to start with just giving you a little background in terms of how I got to the point of being involved with starting a men's support group. I was diagnosed with lupus in 2006, December 2006. And after I got out the hospital and began to think about how I was going to effectively live with lupus. I was thinking that certainly there would be other men that also have been diagnosed, and I would love to try to connect with them as well. So
Yeah,
after,
we have one joint account together, and I put money in that account.
Christopher, you need to mute yourself.
I think he has about $44 in that account.
Christopher Reed, please mute yourself. Thank you. Go ahead, Thomas. I'm sorry.
okay. So maybe a few weeks after having that thought, I received a postcard from the Lupus Foundation, invited me to a support group that was called the Southside Support Group that was co-ed. And I was the only man that was there, but it was very informative, and it kind of gave me an idea of how support groups operated, and, you know, just kind of hearing from others who had been living with lupus, you know, much longer, and some of the experiences that they had. So, you know, it was inspiring. And we kind of got a little bit disconnected for a minute because our group leader had to have hip replacement surgery. So I was asked to become a support group leader. And as being trained, again, I was still with the co-ed group, Southside Support Group, but still had that interest of getting more men, connecting with more men living with lupus. And it was when I went to the Georgia State Capitol for our Lupus Advocacy Day that I met Chris Reed and met another man with lupus. Oh, and prior to that, we did have, as we continued on with our support group, there was another man that joined, and then some of the husbands started joining as well as a, you know, sense of support. So
tell us, Thomas, what did you think? I didn't mean to interrupt you. What do you feel is the benefit? Because a lot of people might not know about the benefits of a support group in dealing with a chronic illness. They have all types of myths and misconceptions about support groups.
Okay. Well, one thing, you are among others who can understand what you're going through. You can share with family members about your aches and pains and doctor visits and different things, but it's nothing like having the conversation with other persons who've gone through that, who really know exactly, you know, how you feel, and you feel a connection with others. Whereas sometimes with family and friends, there's a disconnect, even though they may be, you know, empathetic to what you're going through. There's also that camaraderie of friendship that you develop with others. And that's, you know, really important to know that, you know, if you really need to have someone to talk to, that you can, you know, do that. And as we formed our men's group, first of all, the way that kind of happened was I was receiving calls from men from all over the country, all over the world, who had read an article that I was in with the Lupus Now magazine out of our Lupus Foundation of America. And a lot of men still living in isolation and carrying the burden alone because they don't have the connection, you know, with others. So it is very important that, you know, someone has someone that they can kind of talk to that understands, you know, terminology and just some of the things that one go through in living with lupus.
And help us understand the connection in joining a support group, which is what we've always done at Advocates for Responsible Care, is that the support group also is like the stepping stone to become a better advocate for yourself first, and then advocating for others who are going through your challenges. And tell us about, in your support group, how have you participated in advocacy with the group?
Well, I stay informed with what is going on both through the Lupus Foundation of America out of DC, as well as our local Georgia chapter, who have various educational programs that help individuals, living with lupus from first diagnosed to just going through that journey. And also, because I have been involved with the advocacy committee, had no idea what to do, how to do it. And it was Kim Schofield who helped to connect us, all together and teach us, well, actually just kind of encouraged us to just go to your representatives and talk to them and let them hear your story. And I found that really had really worked, because there were representatives that were interested in listening to what we had to say and understanding how lupus affects us from a day-to-day, standpoint. So in having that experience, we go back and share, with our guys, this is what happened. If you get involved with advocacy, we can make a difference, with more people involved, not only locally, but throughout the country and throughout the world. So that is why we try to connect others.
Here at the Patient Advocacy Alliance, we feel very strongly that patients are the face of policy. And what moves our legislators is hearing the personal story. So when we bring legislation to them to increase access and affordability, that's what's most important to us, is to gather the stories so that we can bring an army of voices with us when we go to speak to our legislators and move legislation and bills that benefit all patients, not just lupus patients, but anyone basically suffering from a chronic and rare disease. And we're going to be encouraging everybody here to join our Hear Me campaign, which is actually getting a story bank of everyone's story. And the difficulties that they've had with any access issue, any affordability issue, because that's what's important to all of us. And I know Thomas and the Lupus Foundation of Georgia has stood up and been at the forefront with us in moving legislation. So what we did today is that we thank you. We thank you, Thomas, and your whole group. And we thank you for coming today and talking to us and helping us understand how that bridges the gap between what Georgia Bio and the biotech community is doing and the patients having a voice at this terrific table. Thank you, Thomas.
Thank you for inviting me.
Ashley, I turn it back to you.
Thank you so much, Thomas. As Dorothy mentioned, it's always so important to have our patients and their stories front and center. And I'm so glad, Dorothy, that you mentioned the Hear Me campaign. That is actually something that Jack and I discussed in our pre-recording yesterday, which we are going to try one more time now. And hopefully we will get it right this time. So I apologize, but you all understand in this remote world, we are just doing the best we can. All right, we're going to try this one more time.
Any groups, so those are the experts. Those are the people we rely on to get the correct input that we need. They're the boots on the ground, so to speak. That's where we get our information from our constituents, and they're a great resource for us. And some of the people that we rely on to help people, rare diseases, community groups, they're a great resource for us.
Excellent. And based on your experience with these advocacy groups, I know at the state level, we're very much the same. We depend heavily on these patient groups because they can give us those firsthand accounts. They know what they're experiencing every day. But what are some of the more effective means of advocacy that you've experienced? And just to kind of help drive that, is in person more effective than virtual? How do you guys deal with email correspondences? Are some of those better than others? And I've got a few other questions follow up with that as well. But
yeah, no, and those are good questions. ensuring that we get timely information, as well as meeting with folks in person. Some of the critical things I would advise on. Virtual, albeit tell it with the pandemic, things obviously had to be virtual. But putting a face to a name, seeing who these policies affect, so who are the patients of these policies and things that we can help with. Email systems, are very helpful as well, making sure we get that information in front of us and ultimately up to the congressman. Disseminating that information to us. Who are the constituents involved? Is this a national issue, a state issue, a local issue? While we work on a lot of federal issues, we try to help with everything that we can, and connecting those folks to appropriate means.
Excellent. And in terms of, you mentioned getting timely information, and I know there are 100 different things firing off just at the federal level at any time. So in your, what is the most effective way to get our information to you? Is patient testimonials, any type of information or development, treatment or insurance coverage? What is the best way to get that to you in a timely manner?
Sure. So first and foremost, I just want to say, any way you can contact us. We want to hear from you, as I was saying earlier. We're open. We're always taking meetings. We want to hear from you all, whether it's phone call, a virtual visit, in person. Understand it's hard to get up to Washington sometimes. So even an email, just shooting us a note, letting us know what's going on, who's it's affecting, some of the recommendations you all may have. Because ultimately we want to work with you all and support everyone that we can and put patients first.
Excellent. And is there a specific group that you've worked with that does a really good job of kind of packaging this information, getting it to you in an efficient manner, or an effective manner, whether that's infographics, just sending you an email, a call, videos, someone who kind of goes above and beyond?
I think one of the great things that we've seen with effective advocacy is what we've seen with patients and pharmacy groups, especially with the news of the FTC study. Mr. Carter has been calling on FTC, the Federal Trade Commission, to have a study on pharmacy benefit managers. They voted against the study, albeit a split decision. And some of the advocacy and grassroots level that we saw, not only coming to us, but going to the FTC and advocating it. Look, this is how a certain industry is affecting patients' access to care. And pharmacies as well. And so I think that would be a good example to point to of how your voice matters and can ultimately lead to change.
Excellent. And I know Dorothy, our patient co-chair, will be praising you mentioning that. That's been a huge issue at the state level as well, and something that we'll be covering in just a little while on our state session wrap up and forward look for 2023. So thank you for mentioning that.
Of course.
So on the flip side, what are some of the ineffective means of advocacy? I know we've heard patch through phone calls or mass emails that are not personal or specific to any one person. So what are some of those ineffective means for us to kind of avoid?
I don't think cold calling or making sure your congressman is aware of your concerns is definitely important. Or congresswoman, member of Congress. Cold calling maybe a staffer, would it be that helpful? Expecting to speak with someone over the phone, albeit immediately. Maybe the campaign emails. It's always nice to get a personal email or a personal note from a constituent or an association. While they're effective in disseminating information, you may not be able to connect with someone with what you're hoping for, I guess, through that.
Excellent. And can you think of any specific ways? I know you touched briefly on the FTC and the success of the grassroots there, but are there some specific ways that our group could help you or be helpful to Congressman Carter or your office as we go forward?
Highlighting, all things, drug pricing policies that we have, but only, putting patients first. Some of these things that we've seen on the other side of the aisle, what they're pushing for, may not always, put patients first, or may lead to, fewer cures. Highlighting, obviously the things that we're going on, putting patients first, and being a voice on the ground would be super helpful for us.
Excellent. That actually segues perfectly into my next question. We know that Build Back Better is likely to come back with some form of drug price setting provisions, which we know will adversely impact patient outcomes with limits to innovation. Can you give us a little bit of an update on both the outlook for Build Back Better and Pasteur? I know that's been a huge issue for our member companies as well, and also have an impact on patient outcomes.
Absolutely, and some of the things we saw with, Build Back Better, or Build Back Pro, because we should call it, leading to fewer cures, less innovation, stifling all that, how that affects patients. We even had a member of Congress state that they were okay with the BBB leading to fewer cures. We don't know if that's diabetes, Alzheimer's, cancer. We don't know. But that's something that they are continuing to push for. We were able to squash it a couple months ago, and it seems like it's starting to come back. Senator Manchin and Senator Schumer are having their conversations and have not come to an agreement. We are hearing words it could come back around, but seeing how unsuccessful it was, I'm not too sure if it eventually does. In regards to the Pasteur, say that's something that we're hugely, supportive of, or as Congressman Carter is a co-sponsor of, and it's a very critical issue in the response to, some things that we knew were important, but realized just how important they were during the pandemic. Whether we attach that to the Prevents Pandemic package, whether it comes, from the Senate over the House, is something we're keeping our eye closely on.
Excellent. Anything else that's kind of percolating at the federal level that you'd like to highlight for our group, or maybe engage us on, get some patient testimonials or information from some of our local groups?
Patient testimonials are always super helpful in, regards to how, BBB will lead to fewer cures and hurt patients' access to care. I would also, highlight the FTC study as well, how pharmacy benefit managers are leading to patients losing access to life-saving care. Some of those things are what we're working on and want to highlight. And overall arching theme of that improving transparency, making sure patients are aware of what's going on, where their drug price are coming from, how really asking a patient, how much is the value does a PBM have to you? And the answer is none. So those are, I guess, some of the things I'd like to maybe end on.
Excellent. Well, Jack, thank you so much for taking the time. I know you guys have a crazy schedule up there, and we're so grateful for everything that you and especially Congressman Carter are doing. He's been an incredible ally for our industry, for patients, and for the patient voice in Congress, and we're so grateful, and we look forward to his continued work and being able to work with your office going forward.
No, and thank you for having me. And please, we want to know how we can help, especially our constituents, and improving innovation, which leads to more cures. So would always want to hear from associations and the groups that are out there that know what's going on.
Excellent. And do you mind if I share your email address with our group so that they can contact you with any of their patient testimonials or information?
Please do.
Absolutely. Well, thank you so much.
Thank you for having me.
Recording now.
All right. So I will add Jack's email to the chat so that everyone has it. It seems like, especially the patient testimonials, which Dorothy just touched on, is something that they would really love to include more of in their conversations and would certainly be helpful to them as well. So if you have one, I know Tia is on the line right now. So Tia, thank you. We already have one from you. If you want to share your story, that's certainly something that we encourage and can help you do. Ryan Brooks, who we're going to hear from in just one second, is our communications and marketing manager, and he is an incredible wordsmith. So if you want to set up a time to speak with him and have him help you put your story into words, we can also record, as we just did with Jack's conversation. We have a lot of options, but when he says that the patient testimonials are really impactful, he means it. That your stories have more meaning than you know, and being able to put a face to these issues, especially at the federal level where they're a little more disconnected from the communities, really does help them, really does help drive home the actual impact of their decisions. So please reach out to us if you would like to share your patient story. We will also be featuring these at our Patient Advocacy Summit on August 23rd, and we will touch a little more on that in just a minute. But now I am going to turn it over to Ryan Brooks for just a minute. Even though he is our communications manager, he in a former life was a congressional staffer. And I just wanted him to follow up a little bit on what Jack said and some of the effective advocacy methods that he experienced from a district office level, because he actually did work very closely with a lot of patient groups, advocacy groups in his time with Congressman Tom Price's office. So Ryan?
Thanks, Ashley. And yeah, Jack gave us a very good overview of connecting with the Washington office, but it really can't be overstated how important it is to foster relationships at the district level. And it's often much easier, the staff is much more accessible. And it's just a great way to start building that rapport. And you really want to focus on like the schedulers and the field reps, because they can get you on the calendar. And a little pro tip is generally somebody is driving the legislator around from event to event. So once you build a little bit of a rapport with the folks you meet with at the district level, you can usually put a bug in the driver's ear, and they're going to have the congressman or senator in the car, sometimes maybe for an hour. And if you build a good relationship, they can really go to bat for you. And one example of some folks who did a really great job when I worked in the 6th District were the Alzheimer's Association. They kept in regular contact. They would bring small groups into the office and always have those personal testimonies that were ready to go, in front of a congressional committee or something like that. And I can say this now, because I would go speak in front of advocacy groups like CARE in the past about effective, relationship building with congressional offices. And the first time I did that, I accidentally solicited a bribe of baked goods, which I couldn't say that then, but I can say it now. They love some advocacy groups who can bring them some cookies. It's never an unwelcome sight, and that does go a little bit of a long way. So that's kind of all I have to contribute, unless anyone has some questions.
That's excellent, Ryan. Thank you. And I think those are great points. Obviously, about the baked goods, you get more with honey than you do with vinegar. So I mean, there's sweet tooth, a great way into a congressional staffer's heart. But also about really having those relationships with the district offices. I think that's very important. And for those of you, I know several of you already have good relationships with your local legislators, with your congressional offices. If you do not, please reach out to us. That's certainly something that we can help you with. We can help make those introductions. A lot of our connections right now are with the health LAs out of DC in most of the Georgia congressional delegation offices, but we certainly have connections or can get those for you in the district offices as well. And I think that would be a really meaningful way for you all to get involved. And with that, I'm going to turn it back over to Dorothy to give our 2022 legislative session overview and 2023 outlook. We have a few things that rolled over. I hope Dorothy agrees. I think we had a very successful session. There were still a few we would like to have seen passed that kind of failed at the 11th hour. But overall, we were proud of what we were able to accomplish and still have some work to do. So, Dorothy?
Yes, we did, mental health parity bill was really probably one of the biggest accomplishments that we managed for this past session. And we were very proud of that. And also the Rare Disease Council passing. That's very important to this group. Realizing now that they'll have a seat at the table under the dome. And this is going to help us so much more to help our legislators understand. That's what we're looking for. We're looking to help them understand what this is like on a daily basis when you are challenged with a chronic and rare disease. And once we educate them more, we can engage more effectively in the advocacy issues. Two things I'd like to say that's very important. We continue the fight. I don't want to upset anybody on the call, but we will continue the fight with the PBMs for one reason. It doesn't matter what our legislators do in terms of legislation to give affordable access to medications. And I think this is one of the problems with that piece in the Build Back Better bill. It's like they want to negotiate better drug prices. However, if when it gets to the pharmacy benefit manager from your insurance company, if they're going to deny you because there's no way that they have to tell you it's okay to get the drug that you and your doctor know you need, it doesn't matter what legislation we have. So it's very important that we continue to highlight the fact that within the insurance industry, we want the insurance industry, we all need insurance. But we don't need people who are blocking and creating bigger barriers to access to care. And it's a matter of educating our elected officials about this issue because they're thinking they can just pass legislation and everybody's going to get the drugs they need. Unless they're involved at that minute level like we are at healthcare, they will not understand the connection here. Again, why our stories matter. Also, call out your state representative and your senator. Get on Facebook. All of you are on Facebook and Twitter. Just put the @ and then put their name and call out to them and tell them what a great job they're doing. Thank them for their service to Georgians. And that's another great way to start making that connection. Put your group down and put their name down in a Facebook message and on a tweet. And that's somebody on the staff is going to see that you call them out. And that's another good way to make the connection. Also, what we weren't too successful with was any PBM oversight regulation and getting the rebates back to the patients. So this next session, we're going back. We're going back with everything that we weren't able to get past. And we're going to approach leadership again. And this time, I hope we can go back with more of you in voice behind us. So that is why your stories are important. We don't just need to know how you got the disease and the challenges of getting a good diagnosis and treatment. We need to know what are your barriers to having this? What are the challenges that you face in getting the access to the medical care, the treatments, and the prescription drugs that you and your doctor and medical team know that you need to have? Ashley, what else should we talk about from the session that we missed?
I think you hit on most everything from a patient perspective. I will say, for those who are interested, and I see a couple of groups on here represented and a couple of companies on here represented who are already engaged. But there is a discussion on biomarker legislation moving into 2023. I know it's still in the early stages. There's model legislation and it's kind of being tweaked at the moment to better fit Georgia, or at least to better address Georgia. If that's something that your group is interested in participating on, we would very much welcome your input, and certainly your advocacy as we move forward. These things tend to take several years. And especially when you're dealing with anything as I will use my rudimentary language as scientific, as biomarker legislation. It's going to take time to educate legislators on the benefits. It's going to take time to educate legislators on exactly what it is. So we know that we have a long road ahead in terms of education and advocacy, but in the long run, it would be having legislation on the books for coverage of this testing would greatly impact better patient outcomes. Eventually, it would take a little bit of time, but eventually it would be better financially for the state. So we're very hopeful that we can get some good education in on that issue, and would certainly welcome any of your input, especially those of you who have experience in that space. I know several of our patients and patient groups do, so we would certainly welcome your input there.
And I'd like to say that moving forward on biomarkers is going to help all of us, all of the patient groups here, all of the patients who are listening today. Tell your friends, this is important for all of us who are challenged by a serious illness, because even if it's targeting, you're saying, well, I don't have that disease. How is that going to help me? It will help you, which leads me into the other piece that we're going to be focusing in on for next session, which is going to be, as always, increasing the accessibility to clinical trials. It is so important for all of you to realize how beneficial clinical trials are. For some patients, it might mean the difference between life and death, or getting treatment and not getting treatment. There are many things about clinical trials that on our next sessions we're going to be talking about that are so important that we all participate in them. So don't think that there's nothing for you. It doesn't affect you. It does. Clinical trials are going to be the future to developing the treatments and prescription drugs that we all need. And in some cases, even eradicating the chronicity of the disease that we might be able to target. So we're going to talk about that. And we come up to our summit in August. So in August, we're having our fantastic summit. And we hope that you will all not only be on it, but that you will all spread the word for us. Help us spread the word and get more patients and patient groups involved in this alliance. This summit is going to be wonderful. And look at that, how fabulous. So we're going to be first addressing the future of mental health in Georgia, having the mental health parity bill just passed. It's a perfect setup. If you don't know, Representative, and I know our speaker Ralston got a lot of the credit for this bill, but I will tell you, I have been working with Mary Margaret Oliver on this for years to be able to get mental health parity passed. So she's graciously going to speak to us about it. Kim Jones from NAMI is going to speak to us about it. And then we're going to do a patient advocacy group panel. This panel is really to help everyone understand how patients should not have to feel they go through it alone, that they can get support, and it doesn't have to be a psychiatrist or psychologist. Just as Thomas said, walking in those shoes of somebody else who knows what it's like. But we have some goals that we want to get out of this. So in the future, we're going to be sending you a survey that we're going to be putting up on the web about support groups. And we'd like you to all take the survey and please pass it around to your other members. And then we also will be focusing in on 3 support groups and just talking to them about how, from getting this support, it empowers us to stand up as advocates for ourselves first, and then we can learn about effective advocacy to go out there. And particularly, like Ryan said, on the ground here in Georgia, how do we go out there and make a difference? How do we go out there and ensure that our elected officials are hearing our voice? Remember, they work for us. We're their constituency. So we have to be able to have our voices heard. And, you know, you can always contact me individually if you're having any problem with that, dlg@arxc.org. And I would be happy to talk to you about that. And then, as I mentioned, we're also going to be discussing the benefits for patients and patient groups of clinical trials. And I'll be writing a blog that will go up on our Patient Advocacy Alliance space on the Georgia Bio website about this. I have been a participant in clinical trials most of my life, having systemic lupus and cancer. And many times, something that I never realized until it happened to me, even being a nurse, is how I didn't have a means of getting before the ACA insurance. So I didn't have a means of getting the ongoing medical care that I needed. And entering a clinical trial gave me that opportunity. Because when you're in a clinical trial, you are the focus. So they have to listen to everything that you tell them about the challenges that you're going through every day, because it's part of them doing the job. So we're going to talk a lot about that. We have 2 wonderful physicians from the Grady Gold Project, which is the lupus project at Grady Hospital. And we're going to be talking to them about their experience with clinical trials, their principal investigators, and also how they work with their patients in engaging them in clinical trials. So there's going to be a lot going on. And I see 2 of our questions are already up there about belonging to a support group and letting us know how this group has helped you effectively advocate for yourself and for others. So that's really a lot of our goal. A lot of our goal is to move people from support to empowerment and being great advocates. And we want to help them do that. So we're going to continue to talk about advocacy and how we can come together and be able to be more effective advocates and really help our legislators understand why this is important. The good news and the bad news is at some point, illness is going to affect our legislators, whether it's personal or someone close to them. So nobody is that far away from understanding what this is like. It's our job to help them see the picture clearly and then let them know very clearly and succinctly what they can do to help us.
Excellent. Thank you so much, Dorothy. And I see here that we've gotten a few comments in the chat about additional panels. We had originally only scheduled this for 2 hours. However, if those are of interest, if you guys have ideas about speakers, we could potentially move some of this around, maybe shorten some of the sessions to include more topics. So you all just let me know. Overwhelmingly, we heard, I believe it was our first year, that it was maybe a little too long. So we shortened it to 2 hours virtually. So we want to make sure that we're still addressing your desires for this summit. And Tia, and I believe it was families future empowerment. If you all have specific speakers or ideas, please let us know, and we can certainly try to figure out a way, even if it's something that maybe we record before and offer as an additional panel, as additional content. We have some options there, because we do want to make sure that we're getting the content that you all want to hear and the answers that you all want to hear or want to receive. So
And also realize that we do other roundtables. So if we can't fit it in for the summit, I think our roundtable after that is in November, Ashley.
I think so.
Yes. So, you know, we would be happy to address it at a roundtable if it's something that has a little bit more legs to it and we want to spend a little more time on it. So please, as Ashley said, let us know what you're thinking. And, you know, realize when we talk about advocacy, chronic illness, and rare diseases, we are talking about children through seniors. So, you know, it's kind of like shingles doesn't care about that. Illness doesn't care about that. So we know that we have to cover from children through seniors, and many of these diseases affect children, and they start with children. My youngest patient was 4 years old in all the years that I've been doing this work. So, you know, it can be heartbreaking. I've known of patients from 18 months who get a chronic illness. And of course, that's aside from the cancers. So, you know, we're very cognizant of that. So we want to bring everybody in.
Absolutely. And just to draw attention to it here, I have put in the chat Jack's email, Ryan's email, both mine and Dorothy's as well. Please, if you are willing to participate as one of our patient testimonials, please reach out to us. If you do have ideas or speaker ideas for either an addition to the patient summit or to a future roundtable discussion, let us know that as well. Tia, I will say data privacy is a huge legislative issue right now. It's something that I think they've addressed past 3 years and will continue to address issues with. So that's certainly a way. Patient privacy is privacy in general is certainly something that we can address maybe as a standalone roundtable discussion as we are heading into session. But I think that's a very timely discussion. And we would certainly like to highlight that. I also put in the registration link, which is now open for our August 23rd Patient Advocacy Summit. It will be our 3rd annual. So we wanted to get this information out as quickly as possible to give you all enough time to recruit some of your members to join us. We did hear you when you said we know that COVID has once again spiked. And we are being sensitive to that, and we'll continue to hold this virtually for right now. We are exploring the idea of maybe a lunch or a happy hour or some sort of in-person social event that we can do safely towards the end of the year. So we will get you more information on that. If you have strong feelings about that one way or another, please let us know, because we certainly want to provide that opportunity, that networking opportunity for you all as well. One more. Excellent. Thank you, Tia. I appreciate that. And also, just so you know, these are the topics that we plan to cover. As you can probably tell, our agenda is not fully fleshed out. We do still have a couple of items where we are seeking 1 or 2 other panelists. So if you have an idea, if you have a recommendation for one of these or something completely different, again, you've got our information, please reach out. This entire alliance is about you all and about making sure that we are amplifying your voice and what you want legislators and decision makers to hear. So we want to make sure that we are giving you that opportunity and that megaphone to do so.
When we do our survey, we're also going to be reporting on the results of that survey at the roundtable on support groups and empowering advocacy. And I also want to make note, based on what we just spoke about, that in our story bank, we do not share anyone's story without their permission. That has always been our policy. It will continue to be our policy. It is a legal stand that we take, and your information has to be safe with us. It's a HIPAA regulation. And in order for us to function and operate in Georgia, we uphold that very strongly. So we are very sensitive to that. So I wanted you all to know that. So your stories of, again, barriers to getting the care, the treatment, the prescription drugs that you need is really what we're focusing on for this year.
And please take that. I will send all of this in a follow-up email so that you have it all easily accessible. But we have even adjusted the prices. Oh, okay. Thank you, Ryan. We have adjusted the prices for this year to make it even more accessible. It is once again free for patients. For our member companies or members who are not patients or part of patient groups, it is only $10. And for non-members, it is only $20, because it is that important to us that we get more people involved. We wanted to make sure that we made it as accessible as possible. So please share this far and wide. It helps bring more patients into the fold for our Patient Advocacy Alliance. We've continued to grow. I know our numbers are still a little small now, but we are still growing. We are still growing in effectiveness, I think, as well. And we want to bring more and more into this fold and have this really be a great advocacy arm for the association and for you and your efforts at the Capitol. So help us help you is what I'm saying. And with that, I think that's everything on our agenda. Dorothy, do you have anything else?
No, I just want to encourage people to reach out just like you did and let us know what you're thinking. And we're going to reach back to you with the survey once we have that formulated, and we'd love you to share it with people. We're going to make it as easy as possible, multiple choice. And the more feedback we get, the better we'll know what the needs are of the patient community. That's what we're interested in.
Excellent. Does anybody else have any questions, comments? I will mention, Ryan put here in the chat, Georgia Bio is hosting a member happy hour with GIPA and Women in Bio. It is open to any and everyone, and I think he posted the registration link there. So if you are interested, if you feel comfortable, we are hosting it at Roundtrip Brewing. It's a nice big space. It is indoor, so but it is very large. So we did take that into consideration. If you feel comfortable, if you would like an opportunity to network with some of your fellow patient advocates or our member companies, please register for that today. And register early for the Patient Summit. You don't get anything special except my admiration.
And mine.
And Dorothy.
And my deep appreciation. Spread the word about the summit. The more people we have, the more we can serve everyone. So we're really interested in what you think.
Absolutely. Well, thank you all for joining today. And like I said, I'll send around a follow-up email with all of these resources and information for you. Thanks, everyone. Have a good afternoon.
Thank you so much.
Thank you.